What physiologically is happening to a child at that point?
So he was in the middle of what we call a life-threatening asthma attack. And the fundamental bit of that is that your airways, so you've got your lungs, and within your lungs you've got your airways. So they come down from your windpipe, and then you have two other tubes that come off those, your main bronchus, and then they go out and they fill, and that's how the air moves through your lungs. Within asthma, what you get in an acute attack is that those airways are already inflamed because they've got asthma already, and then they've been exposed to a trigger, and that trigger has gone and has caused those airways to get tighter, more full of immune cells, so white blood cells and things that make things irritated, a bit like when you get a rash on the outside when you have an allergic reaction, similar kind of concept inside. And so you get your trigger, and without enough medication to relieve that, it will just keep getting tighter and tighter. So that position that you're talking about, that kind of almost like tripoding forwards with your arms forward, that's you trying to keep your airway as open as possible and you forcing the air into your airway. The problem with asthma is that you can get the air in, but then it's really difficult to blow it back out because you're blowing out against these much thinner tubes than there should be. When you have an asthma attack, you take a reliever inhaler. Most of the people will have a blue one, sublingual. And that one, when you breathe that in, it's a bronchodilator. It acts on cells within those muscles of the airway, and it relieves them, it opens them up. The problem is that you get to a point where it doesn't matter how much of that you give. If it's that bad and that far through an asthma attack, it doesn't work in that moment. So you scooped and run. That was the best thing to do, because while you still need to give those medicines, you need to give oxygen, nothing at that point potentially would open up the airways enough, and that's why you need to go to A&E. But that's an acute attack. And unfortunately, in the UK in particular, we have some of the highest rates of kids dying from acute asthma attacks for various reasons. Relevant to this, air pollution exposure is one of them. But that acute asthma attack, that inability of your airways to relax, is one of the key issues.
And what's the difference between children that are having more typical asthma attacks, so asthma episodes of some description where they have to pull out the blue inhaler to have a reaction? What differentiates those attacks from ones that end up where you go beyond this line where it's not retrievable with the home medication? It's
probably a combination of things. It's probably that there isn't enough of the preventer medication. So your other inhalers that you take, we call them preventers, the brown inhalers, purple inhalers, white inhalers. And what those inhalers do is they remove the inflammation. They stop the cells from being inflamed. And so that means that when you breathe in a trigger, your cell, even if you tighten a little bit, it doesn't cause as much of an issue because you've relieved and you've removed some of that initial inflammation and swelling. And so either we're not giving them enough of the right medicine, or it's just that on that day, that trigger was just too much and it pushed the cells into overdrive. And that's why they've ended on to have a severe asthma attack.